Hi, Julie Lashley with Gaddie Eye Centers. I'm here today with Dr. Troy Moats, and we are discussing children's eye exams. At what age, Dr. Moats, do you start children's eye exams?
Well, assuming everything went normal with the child as far as pregnancy and delivery, because if there's complications, a specialist would take over at that point. But we see them as young as 6 months of age. And in the state of Kentucky, starting at 3 years of age is when I see a lot of kids going into Head Start, or 5 years of age when they're going into kindergarten, because that's what the law requires for us to check
We
out.
did get a question yesterday from a parent. Do you require that children get an eye exam every year?
It's not necessary every year, unless there's something going on, if there's some high prescription or something else we're watching with them. But generally every couple years after that is fine if everything's normal.
Okay. And let me ask you this. Why examine children's eyes?
Well, there's a couple of reasons. About 80% of the information that comes into the brain comes through the eyeballs. And so if there's a problem with that, a child may have problems with learning. And we make sure kids have their shots and they're healthy and everything, but we're not making sure that they can see when they get to school. So that's important. But also, we want to make sure that there's just normally developing vision. A kid can't tell if things are normal or not if they're running around blurry. To them, blurry is normal. And if one eye is normal and the other eye is blurry, well, then the normal eye is going to cover up. It takes a doctor to figure out if there's really a problem or not.
So a pediatrician would not be a good
No,
advice for a parent, you think, maybe?
pediatricians do a great job as far as the screenings, and the school nurses help out. They do excellent work with the screens. But sometimes things can kind of eke by, and just with a thorough, a comprehensive eye exam, we can flush out any problems.
So that would be the
there.
difference between the two. We do get that
Yes.
question a lot
Oh,
as
yeah.
well.
Yep.
Okay. Tell me, how do you give a 2-year-old an eye exam?
You can't ask them which is better, one or two. It doesn't work, and that machine usually scares them to death anyway. So it's usually in a lot of just our lights, our retina scopes, flashlights, ophthalmoscopes. We have a computerized autorefractor that helps me know if there's a prescription hiding in there. But also we dilate their eyes as well now. A lot of people have their eyes dilated, and as adults, you know, all that fun lasts for a couple of hours of that blurry vision. But for the kids, we use a different formula that really gets in there and relaxes that focusing system, so we can make sure there's no prescription hiding in there. So we're flushing it all out. But it takes a couple of days for that medicine to wear off.
Okay.
So during that time, they have to wear their sunglasses, and they'll have the big eyes, but it goes away.
Is there any preparation that a parent should take in bringing their child for an eye exam?
Don't say the shot word.
Okay. That's valuable.
I get kids coming in, they're terrified when they come because they think they're going to have something going on, shots or anything like that. And I'm like, no, I'm kind of the goofy doctor. I wish people would come see me first before they would go see the other doctors.
I have to agree with that. Let me ask you, is that why you don't wear the white coat?
Yeah. I don't like white coats, and kids don't like them
No, I don't think
either, too. They're scared of it, and that's bad news when it's coming in there, too. Sleeves rolled up, no tie, just making the kid feel comfortable, and just get to have some fun with the kid. That's the best part.
I have 2 children of my own, and at the age of 2 and 3 years old, they had no symptoms. Everything was normal. They weren't showing any signs sitting close to the TV or anything like that. No complaints from anyone. What would you tell a parent that tells you that they're fine, everything's okay?
You know, as we kind of talked about before, that the definition of normal for a kid, to them it's normal. They don't know what normal is to the rest of the world. So obviously that's something we would check out as far as, are they sitting too close to the TV? But I think every kid does that. They just want to it's not a optical focus, it's a mental focus. I want to be right on the TV, nobody bother my show kind of thing. Their dads kind of do that too, I've heard. But most importantly, we're looking for those health problems in there with the eyes. That it could be a cataract, that could indicate retinoblastoma, which is a life-threatening tumor that can happen in the eye. I guess thankfully I can say I haven't had the opportunity to see something like that, but I've seen some kids come through. They were seemingly fine. They had some swelling of the nerve in the back of the eye. Sent them off for further testing, and lo and behold, they had a brain tumor. So the kid was fine.
So there were no symptoms
No
in the
symptoms
child.
at all until I looked in her eye, looked at that nerve and went, that doesn't look right. Pulled out my notes from last year going, well, it was fine then, it's not fine now. Let's go. And
So
not the greatest news you want to get,
Right.
but at least you get to the root of the problem so you can start taking care of
Okay,
it.
so there are so many other factors other than just can you see or not see?
Oh, it's just making sure things are healthy.
Okay.
You know, so many things with our body, whether it's the eyes or the rest of the body, there's no symptoms until it's too late. And obviously you want to catch things.
Absolutely.
Ounce prevention, pound a cure. I've become a big believer
Okay,
in that one.
Dr. Moats, what differentiates you from all the other eye care practices?
We do amazingly comprehensive eye exams in here, seeing everybody from 6 months of age up to, I don't know if I've had a 106-year-old, but I've had some senior citizen
up there.
patients. So we're seeing the young kids to the senior citizens. We accept all the insurances, the ones that cover the kids, all the way up to Medicare. That's going to help out our senior citizen population. And if there's any problems along the way, we have wonderful equipment here. We have the kind of the run-of-the-mill optometric care, but we're also blessed to have the Optomap, which takes excellent pictures of the insides of the eyes. OCTs, the optical coherence tomograph, which lets us see down into the anatomy of the retina like nothing else can. The GDX scanner that lets us diagnose glaucoma before it ever show up. So we have, as I said, we're blessed to have excellent equipment here and excellent doctors that know how to utilize those instruments.
Great, great. If you'd like to know more information about Gaddie Eye Centers, you can visit us at www.gaddieeye.com or you can follow us on Facebook.